Meeting you all. Oh, I'm sorry.
That's okay. Thank
Okay.
you, Anisha, for joining us, Professor Henderson. We're so excited that you were able to join us today. So, we're going to start out by you telling us a little bit about your role as a nurse educator and what led you to taking the CNE. So, welcome and congratulations.
Thank you. I appreciate it. Thank you for having me. So, currently, I'm a nursing professional development specialist at a hospital here in Dallas. And I also teach simulation skills and didactic at a college as well as an adjunct professor. I started education about 2 years ago, and I was teaching only didactic, and I didn't really have a mentor or a role model.
Mhm.
So, a friend of mine recommended the Red Caputi book. So I
Mhm.
was actually just reading through that, and then actually that kind of guided me to want my CNE because it was helping me understand, students and think the things that I should be doing. And then I heard about Dr. Sellers, so that kind of led me to, taking your course.
hmm That's awesome. Now, you left out another part, which is about your journey. So tell us a little bit about your academic journey too, because I think you're in a PhD program and a very busy colleague. So talk a little bit about that too, and really what your goals have been.
Sure.
And I know you said the Caputi book was influential, but as we know, certification is often not a requirement for some colleagues, just like me. It's a personal goal. So tell us a little bit about your academic career as well. I think it's fascinating and amazing all the things you've been able to accomplish.
Okay. For education wise, I started off, I don't know, I'll go back kind of far, but associates, bachelor's, master's, and then now I'm in my PhD program. And so my dissertation is kind of surrounding nursing education. I'm really big on simulation. That's one of my next goals is to obtain the certification for a simulation
hmm
educator. So that's that. So yeah, I'm still in a PhD program and I was taking Dr. Sellers courses at the same time and raising a family of five. So it was a rough, but I feel like if I could do it, anybody can definitely do it.
Absolutely. Well, you stayed committed, and
Yes.
I know sometimes the weekly sessions can be a lot because that's 6 weeks and then the
Yeah,
master class as well. And I just appreciated your commitment and really your drive for success because I think that's ultimately what has to push you to crossing that finish line.
definitely. Definitely. And
Okay,
I think the
great.
structure too, the structure that you provided, like the layout, the blueprint, the way my brain works, if you tell me exactly what to do, I can do that. So that really
Mhm.
helped me as well.
Good, excellent. So we're going to talk through a couple of questions, Professor Henderson, just
Okay.
so colleagues can get a sense as to what your pathway looked like.
Okay.
Tell us about, because I see you were in the May cohort, the May 2026 cohort.
Yes.
So talk to us a little bit about what your weekly commitment was, how many hours that looked like. I know we also had that one-on-one call where we had a hopefully helpful yet honest conversation about
Yes.
what your next steps are going to be. So just take us back to
Okay.
May when you started the CNE in 60 days up to the point where you celebrated your success.
Okay. So taking it back. Okay. Let me think. So far as like the hours, I spent a lot of time studying. I mean, that was a part of my daily routine.
hmm
So I think it was a reference guide that you provided us, and it lets you know like how many hours you should be studying. When I first seen that, I thought that was crazy. But I was like, oh wait, no, I need to like it made sense. Like all the readings and being able to attend the classes and be able to speak to what you guys were, talking about, all that made a
hmm
difference. So I studied every single day.
Mm.
Um, I'm trying to think what else. Obviously, attending the classes. What else question did you have? I'm sorry.
No, that's good. And I know that we talk a lot about that CNE exam blueprint, kind of doing that
Yes,
self-assessment. Is that a step you took at the beginning,
I
using the
actually
blueprint?
I did. Yes, I did that. I looked at the blueprint. Like you said, I did the self-assessment. The blueprint was like my go-to. Like I
Mhm.
liked how the foundation that you created, it aligned with the blueprint, and so that really helped me condense and understand what was needed to be known. And then
Mhm.
also I also understood that it wasn't about memorization. It was really about
Mhm.
like being able to apply. You
Mhm.
also gave us tips about when you're reading a question, what is this question asking you? So the whole time I'm taking my CNE, I was like, okay, what is this question asking me? Like that was me the whole time. So that really, I mean, it's something so simple, but it really helped me. Okay, so is it asking me about a theory? What
Mhm.
is it? Is it asking about evaluation? Like, what is it asking me? And then I can start to think back, okay, so what are my theories? What, are we talking about Bloom? So it was really it really helped me identify how to answer the question.
Hmm. Yeah, and I think that's a really good point, also, Professor Henderson, because when we sit for a standardized exam, for many of us, it's probably been a little bit, but since
Yeah,
we've done that, since we've had that experience, and those questions on the CNE exam, they are formatted in a totally different way. We know 80% of those questions are at that application analysis level. So it's exactly what you said. You had to go deeper using Billings and Halstead and Caputi to clarify muddy points that you had. What
correct.
advice would you give, Professor Henderson, for colleagues that may be watching this testimonial and hearing all the honest feedback you're given about that commitment? Any other advice that you would share with colleagues that may be considering, they may be on the fence and not sure about what their CNE journey is going to look like? What would you share with them?
I would, for me, I would say understand how you learn best.
Mm,
I think that's very cliche, but I feel like I learn best by like applying. So I can read
mm,
all day, I can take notes, I understand it, but honestly, doing the questions in the back of the book really helped me understand, do I know this content and can I speak
mm,
to it? Do I know why I got this right? Do I know why I got this wrong? And what am I taking away from it? Additionally, after I did the course, and I did all my studying, I also took the SAE that was,
mm.
provided by when I provided, you had to pay for it, the NLN. So
Right.
I
It's
took
offered
that.
by the NLN, but there's
Thank you. It's
additional
offered.
fee.
Yeah, you got to pay for it. So I did that and and then I tracked my weak areas and then I went back to the blueprint that you provided. I went back to Caputi, I went back to Billings and Halstead, and I really worked on those weak areas. And then after that, I took the other one that they
Mhm.
offered. And then I was able to I actually had no weak areas.
Oh, that's
So
amazing.
that's what I used. That people have mixed reviews on whether
Right.
to take it or not. But the way I learn, I have to be able to apply it to make sure that I am really understanding the content. So I think that
Hmm.
helped me.
Yes, and I think that's a really good point. What you're describing really is that self-assessment, starting with
Sure.
the exam blueprint that is published and posted by NLN, that's included in the candidate handbook. So that's an excellent free resource. And that really informs our curriculum. And then you took it a step further, as you mentioned, Professor Henderson, where you identified how you learn best.
Hmm.
That's so important. We hear some colleagues that spend a lot of time going through practice questions, and this is what we know. The
Hmm.
ones in Caputi's book are really good because they give you the rationale. And
Right.
that's also a resource that we know NLN has endorsed. However, the other resources out there can cause a distraction. So, following the steps that you mentioned were perfect for you because it helped you have that increased awareness, even though we know there's no direct correlation between how you do on the SAE and necessarily, although it did for you, how you do on the actual CNE. It really is taking time to think through those rationales you're given and going deeper into the textbook. So that's excellent. And then
Right.
we had a one-on-one session. Talk to the
Ooh.
audience, colleagues, about that one-on-one session.
I really appreciated the one-on-one, and it's funny how it worked because the day that I wanted to schedule was close to my exam, and then it worked out to where I'm like, oh, I needed to hear all that stuff that she said.
Mm,
You told me to focus on those bigger domains, the
mhm,
facilitate learning, and I thought I had it. I was like, no, I got this. What is she talking about? I got it. No, I didn't have it.
mhm.
So I was so appreciative of the one-on-one and the questions that you were asking me because I'm like, wow, I can't answer that question. So I took notes and I took
Mhm,
that and I applied it to, my studying. And
mhm,
honestly, it worked. So when Dr. Sellers says schedule your one-on-one 2 weeks prior, it's a reason. It's a reason.
Mm-hmm.
It really kind of it helps you identify what you may not know and you think you know.
Mm-hmm.
So she's an expert.
Oh, well, thank you.
You're
And it
welcome.
really is about you all, especially learners like you, really being open to that feedback because
Yeah.
we know sometimes it can be hard to hear. However, we always like to share with colleagues that ultimately it's your decision as to what the next steps are going to be. We make recommendations based on now thousands of colleagues we've helped on the journey. And it's also about the transformational process because we want you to think like a nurse educator and sometimes that can be challenging, but your ability to do that as we engage in our weekly sessions really helps you take ownership for your learning, just like Malcolm Knowles talks about. I can't get away from theory. All the colleagues on this call
Right.
know how much I love theory because I think it really
Right.
grounds us in our why and keeps us moving forward. So we know this is just not busy work, that it's impactful work that we're doing. And having that deeper understanding of why really helps us keep moving forward and helps us have this burning desire of, okay, what am I missing? What can I do differently to keep my students engaged? Well,
Yes.
thank you so much, Professor Henderson, anything else? We know what's next for you, which is your PhD. Now tell us when you're
Yes.
planning to wrap up the chapters and defend your dissertation. How far
Oh,
are you?
I have a while. I have a while. I just finished my first year. I just submitted my last two
Okay.
papers in my first year. So I'm hoping by the end of 28, beginning of
Okay.
29 to be done.
Okay.
We'll see. We'll see. I'm
Well,
I'm in
that's
no rush.
yes, exactly. Well, we know that your plate is quite full, and it's
Yes.
exciting that you can mark CNE off of your bucket list, and we look
Yes,
forward
thank
to
you.
supporting you on your journey for Chessie as well, because we heard you say that's next.
Yes, that is next. That's next for me. I'm ready to start studying for that now. So I have a goal, but we'll see.
Excellent. And clearly, the goals you make for yourself, you stay focused
Oh
and
yeah.
you execute. That's the important part. You didn't just take the feedback that we talked through during your
Right.
one-on-one session, but you also executed and committed. And you're not alone. Listen, we hear from so many colleagues. Once you look at that 7-week study plan, you're like, 110, 120 hours. What?
Yes.
Why is it going to take this long? But we
Yeah.
know that it's evidence-based. It continues to be part of our success framework. Providing that structure is so important because we know time is your most valuable asset.
Mhm. Yes, ma'am. I appreciate you for having me.
Of course. Well, I'm delighted that you came to talk a little bit about your journey, and we wish you all the best.
Yes, ma'am. Thank you. Bye, guys.
Thank
Bye.
you.
And I wish you a lot of luck in your PhD. And just remember, it is a exercise in endurance. It's not how smart you are.
Thank you. I appreciate that. I received that. Thank you so much.
Absolutely.